Hello, welcome to my student support system. In today's class, we will discuss about muscles of trunk, which includes the muscles of thoracic cavity, muscles of abdominal cavity, and muscles of pelvic cavity. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture. Muscles of abdominal cavity. In abdominal cavity, first muscle is rectus abdominis. This muscle arises from the pubic crest and pubic symphysis from here, then goes upward and insert into cartilage of 5th to 7th rib and xiphoid process. These muscles help in flexion in the vertebral column. This muscle is innervated by T7 to T12 spinal nerves. Next abdominal muscle is transversus abdominis. This muscle arises from iliac crest, inguinal ligament, lumbar fascia and cartilage of 5th to 10th rib and goes transverse. That's why its name is transversus. This insert into xiphoid process, linea alba and pubis. These muscles help to compress the abdomen. This muscle is innervated by T8 to T12 spinal nerves. External oblique muscle. This muscle arises from 5th to 10th ribs and insert into iliac crest and linea alba. Working unilaterally means one-sided muscle when they work or act. They flex, laterally flex and rotate the vertebral column. And when both muscles act together, they compress the abdomen or flex the vertebral column. These muscles are innervated by T7 to T12 spinal nerves. Next is internal oblique. This muscle arises from iliac crest, here inguinal ligament, lumbar fascia and insert into linea alba and cartilage of 7th to 10th rib. Working unilaterally, they laterally flex the vertebral column and rotate the vertebral column, and when they act together, they compress the abdomen and flex the vertebral column. These muscles are also innervated by T7 to T12 spinal nerves. The anterolateral abdominal wall is composed of skin, fascia and 4 pairs of muscles that we have just discussed. The external oblique is the superficial muscle. The fascicles extend anteriorly and medially. The internal oblique is intermediate flat muscle and its fascia extend at right angle to those with the external oblique. The transversus abdominis is deep muscle with most of its fascicles direct transversely around the abdominal wall. The rectus abdominis is a long muscle sheath that extends the entire length of our abdomen, and the aponeurosis, or we can say the sheath like tendon of the external oblique, internal oblique and transversus abdominis muscle form the rectus sheath, which encloses the rectus abdominis. The sheaths meet at the midline and known as linea alba, which is a tough fibrous band which extend from the xiphoid process of the sternum to the symphysis pubis. Here you can see that this is linea alba, these are two rectus abdominis, and these are the three muscles: external oblique, and this one is external oblique outside, then internal oblique, and then this one is transversus abdominis. Next one is quadratus lumborum. This muscle arises from iliac crest and the iliolumbar ligament and insert into inferior border of 12th rib here. So this muscle lies posterior to our abdominal wall. This muscle forms the posterior abdominal wall, and working unilaterally, they laterally flex the vertebral column, and when they both act together, they extend the vertebral column. These muscles are innervated by T12, L1 to L3 spinal nerves. Now we come to the muscles of thoracic cavity, and here first one is diaphragm. This is a dome-shaped muscle and which have a central tendon and separates chest cavity and abdominal cavity. It arises from xiphoid process. Here, costal cartilage of lower 6 ribs and lumbar vertebra. The diaphragm help in inspiration or respiration, we can say. This muscle is innervated by phrenic nerve, which is formed by C3 to C5 spinal nerves. Now external intercostals. The 11 pairs of external intercostal muscles lie superficially to the internal intercostals, and their fibers run oblique direction inferiorly and anteriorly from the rib above to rib below. They elevate the ribs during inhalation to help extend the thoracic cavity, and these muscles are innervated by T2 to T12 spinal nerves. Now internal intercostals. Again these are 11 pairs of internal intercostal muscles are there, which lies deep to the external intercostal, and their fiber run in oblique direction opposite to external intercostal. They elevate the ribs during inhalation and help to decrease the volume of the thoracic cavity, and these muscles are innervated by T2 to T12 spinal nerves. Now subclavius. This muscle arises from first rib and insert into clavicle. Here you can see this is subclavius. These muscles depresses and move the clavicle anteriorly and help to stabilize the scapula. These muscles are innervated by subclavian nerve. Pectoralis minor. This muscle arises from third, fourth and fifth rib and insert into coracoid process of scapula. Here you can see. These muscles abduct scapula and rotate it downwards. These muscles are innervated by medial pectoral nerve. Serratus anterior. This muscle arises from the first 8 ribs and insert into the medial border of angle of scapula. These are the serratus anterior. These muscles adduct the scapula and rotate it upwards. It is also known as boxer's muscles. These muscles are innervated by long thoracic nerve. Trapezius. Trapezius lies in the posterior thoracic wall. These muscle arises from the superficial nuchal line here, and then spines of C7 to T12 vertebra and insert into the clavicle and acromion process of scapula. These muscles abduct the scapula and rotate it upwards and stabilizes the scapula. These muscles are innervated by 11th cranial nerve and C3 to C5 spinal nerve. Levator scapulae. This muscle arises from the transverse process of C1 to C4 cervical vertebrae and insert into upper medial border of scapula. These muscles elevate the scapula and rotate it downwards. These muscles are innervated by dorsal scapular nerve and C3 to C5 spinal nerves. Rhomboid major. This muscle arises from the spines of T2 to T5 thoracic vertebra like this from here to here and insert into medial border of scapula. These muscles elevate and adduct the scapula and rotate it downwards and stabilizes the scapula. These muscles are innervated by dorsal scapular nerve. Rhomboid minor. This muscle arises from spines of C7 and T1 vertebra and insert into the medial border of scapula. These muscles elevate and adduct the scapula and rotate it downwards, and again they help in stabilizing the scapula. These muscles are innervated by dorsal scapular nerve. Now we come to the muscles of pelvic cavity. First one is levator ani. This muscle have three components, and these are pubococcygeus, iliococcygeus, and puborectalis. The pubococcygeus arises from the pubis and ischial spine and insert into the coccyx, urethra, anal canal, perineal body of the perineum and anococcygeal raphe. The iliococcygeus arises from the ischial spine and insert into coccyx. Puborectalis is a thick, narrow medial part of the levator ani and it forms the U-shaped muscular sling around and behind the rectum. Levator ani muscles supports and maintain the position of pelvic viscera. It constricts the anus, urethra and vagina. This muscle is included in the pelvic floor muscles. These muscles are innervated by sacral spinal nerves S2 to S4. So here you can understand the muscles of pelvic cavity, and these three components, puborectalis, pubococcygeus and iliococcygeus, they form the levator ani. Now ischio-coccygeus. This muscle arises from the spinal end, ischial spine and insert into the sacrum and coccyx. These muscles support and maintain the position of pelvic viscera. This muscle is also included in the pelvic floor muscles. These muscles are innervated by sacral spinal nerves S4 and S5. The perineum is a region of thick inferior, the trunk inferior to the pelvic floor. It is a diamond-shaped area that extends from the pubic symphysis anteriorly to the coccyx posteriorly and to sides to the ischial tuberosities. Several perineal muscles insert into the perineal body. Perineal body is a fibromuscular structure, or we can say central tendon located in the midline of perineum. Superficial transverse perineal muscle. This muscle arises from the ischial tuberosity and insert into the perineal body. These muscles support and maintain the position of perineal body of the perineum. These muscles are innervated by perineal branch of pudendal nerve of sacral plexus. Bulbospongiosis. This muscle arises from the perineal body in the male and it inserts into corpus spongiosum of penis, deep fascia on the dorsum of penis and root of the dorsum of clitoris in females. These muscles help in expelling the urine and semen through the urethra in the males and constricting the vagina and erection of clitoris in the females. These muscles are innervated by the perineal branch of pudendal nerve of sacral plexus. Ischio-cavernous. Ischio-cavernous muscle arises from the ischial tuberosity and ramus of ischium and pubis and insert into the corpus cavernosum of penis in the male and clitoris in the female. These muscles help in maintaining the erection in the penis in the males and erection of clitoris in the females. These muscles are innervated by perineal branch of pudendal nerve of sacral plexus. Deep transverse perineal muscle. This muscle arises from the ramus of ischium and insert into the perineal body of perineum. These muscles help to expel the last drop of urine and semen in the male and urine in the females. These muscles are innervated by perineal branch of pudendal nerve of sacral plexus. External urethral sphincter. This muscle arises from the ramus of ischium and pubis and insert into the neck of urethra in the male and vaginal wall in the females. These muscles help to expel last drop of urine in the male as well as in the females. And in the male it also helps to expel the semen. These muscles are innervated by pudendal nerve of sacral plexus. Compressor urethra. This muscle arises from the ramus of ischium and pubis and insert into the compressor urethra of the other side of the anterior to the urethra. These muscles act as accessory sphincter of the urethra. These muscles are innervated by pudendal nerve of sacral plexus. Then sphincter uretrovaginalis. This muscle arises from the perineal body and insert into the sphincter uretrovaginalis of the other side anterior to urethra. These muscles act as accessory sphincter of urethra and compressing the vagina in the females. These muscles are innervated by pudendal nerve of the sacral plexus. External anal sphincter. This muscle arises from anococcygeal ligament and insert into the perineal body. These muscles keep anus opening closed and these muscles are innervated by inferior rectal branch of pudendal nerve of sacral plexus. Thank you students for watching this video. For such latest updates, you can subscribe the channel, you can like Facebook page, and for making your notes, don't forget to visit the blog mynursingstudents.blogspot.com. You can follow me on Twitter, Instagram, and join Facebook group Nursing Notes. Thank you. Have a nice day.